आपने जब भी ये स्लाइड्स पढ़नी है आपने पिछला लेक्चर जो हार्ट 5 है उसको ज़रूर नज़र में रखना है। उसको सुनने के बाद आप इस पर आएंगे। सो द फैक्टर्स दैट आर रेगुलेटिंग द हार्ट रेट are intrinsic factors, that is within the heart. If you have got no nerve supply to the heart, even then the heart rate can increase or decrease, and the reason could be an increase in the venous return that will stretch upon the right atrium and that will stretch the SA node. अब आपका जो भी ताल्लुक हार्ट रेट के साथ होगा वो SA node से रिलेट करेंगे हम. So the stretch of the right atrium due to increase in the venous return produces stretch of the right atrium, and that produces stretch of the SA node. The SA node, when it is stretched, the calcium channels are wide open and allow entry of calcium into the SA node cells, and this produces a fast prepotential, and this reaches the threshold point earlier to increase the heart rate. Now we are at the point of nervous stimulation. If the body needs more heart rate to increase the pumping action of the heart and to increase the supply of blood to the body, it tells the brain, and the brain through the sympathetic nerves asks the SA node to increase the heart rate. And what do the sympathetic nerves do? They cause increase in the calcium conductance to make the prepotential more steep. It comes early, it reaches early at the threshold level, and the impulse is generated. In case of the parasympathetic stimulation, when the heart rate needs to be decreased, then the vagus nerve is stimulated, and this causes increase in the potassium outflux, efflux. अब आप इसको गौर से देखें. Here it was calcium influx, and here there is potassium efflux. When it reaches the threshold level, it continues to go down, and under normal circumstances, it reaches minus 60 millivolts and the sodium channels open up and they produce a prepotential. But when there is parasympathetic stimulation, even the sodium channels will definitely open up at minus 60 millivolts, but still they are not able to produce a prepotential because the potassium is continuously going down and it is reaching a level minus 70 millivolts. So when it is minus 70 millivolts, after that, when the potassium conductance is decreased, then the sodium conductance upwards is able to take this potential to minus 60 level, and from minus 60 it will go to minus 40, and then the next impulse will come. So this produces a decrease in the heart rate. जहाँ दो impulses थी normally, वहाँ एक रह गई. So phenomena of vagal escape. If you are continuously causing vagus nerve to stimulate, if you are continuously stimulating the vagus nerve, it may decrease the heart rate to a level that the heart has to stop for some seconds. This this is so alarming a situation that the heart says, no, I cannot accept this nervous stimulation, I reject it, and the heart starts beating again because it becomes refractory to acetylcholine. Either the heart has become refractory to acetylcholine, or what happens is that the stores of acetylcholine on continuous stimulation of the vagus are depleted. There is no more acetylcholine to keep the potassium channels open for efflux, and thus the heart does not respond to the acetylcholine because it is no more available. दो चीजें हैं फिनोमेना ऑफ वेगल एस्केप में. कंटिन्यूस स्ट्रॉन्ग वेगल स्टिमुलेशन होगी तो हार्ट स्टॉप हो जाएगा. हार्ट स्टॉप हो जाएगा तो हार्ट चंद सेकंड के बाद दोबारा बीट करने लग जाएगा एसए नोडल एक्शन पोटेंशियल के मुताबिक, क्योंकि एसए नोड फिर कहेगा कि मैं नहीं मानता तुम्हारी स्टिमुलेशन को, मैंने एक्सेप्ट नहीं करना. या फिर मुसलसल जो उसकी कंटिन्यूस वेगल स्टिमुलेशन है उससे जो एसिटाइलकोलिन के स्टोर थे नर्व एंडिंग्स पर वो खत्म हो जाएंगे, और जब एसिटाइलकोलिन नहीं होगी तो एसए नोड अपना काम दोबारा नॉर्मल तरीके से शुरू कर देगा. The third factors that can affect the heart rate, you do not stimulate it by the nerves, but you take caffeine or you take other drugs, चाय पी लेते हैं आप और heart rate increase हो जाता है. Chemical factors that are reaching the heart through blood supply, they can cause change in the heart rate. For example, if the ECF potassium is increased, it prolongs the repolarization and this will decrease the heart rate. If the blood potassium level reaches 8 to 12 milliequivalents per liter, that is 2 times normal or 3 times normal. 4 जो है वो normal है, 8 का मतलब है 2 times normal और 12 का मतलब है 3 times normal. अगर potassium level इतना बड़ा हो जाए, there is decreased strength of action potential and the heart becomes flaccid. This can cause death. The fourth factor is temperature. You increase the permeability of the sodium and calcium into the blood, into the cardiac cells as synode, and this increases the heart rate in exercise and in fever when the temperature of the blood is increased. Any information from the body that you need to increase the heart rate or decrease the heart rate, as in case of exercise, pregnancy, after a meal and hot weather, we need to increase the cardiac output, and for that we increase the heart rate. The sympathetic nervous system is stimulated reflexly, and this causes increase in the stroke volume and heart rate. Whereas in case of anxiety, stress and the pain, the higher centers, the brain say, please increase the heart rate, and this increases sympathetic stimulation of the heart and increases the heart rate. In case of depression, there is there is sometimes a decrease in the heart rate reflexly through higher centers. Number 6 are the diseases. When there is increased right atrial pressure, as in the case of cardiac failure, this increases the heart rate by decreasing the vagal tone and increased sympathetic tone. आप जब आगे जाएंगे तो आप पढ़ेंगे अगले लेक्चर्स में तकरीबन 10-12 लेक्चर्स जब आपके सर्कुलेशन के हो जाएंगे उस वक्त के वेगस नर्व का सेंटर और सिंपैथेटिक नर्व्स के सेंटर रेसिप्रोकली इनर्वेटेड है. सो जब भी कोई रिफ्लेक्सली ऊपर से ऑर्डर आता है कि सिंपैथेटिक बढ़ाओ तो साथ ही वेगस कम हो जाती है. जब भी कभी ऊपर से ऑर्डर आता है कि वेगस बढ़ाओ तो सिंपैथेटिक कम हो जाती है. सिंपैथेटिक कम हो जाती है, एक्सक्यूज मी. सो ये तमाम चीज़ें रिफ्लेक्स हों या डिजीजेज हों, फाइनली इसको हार्ट रेट को मैनेज करती हैं अकॉर्डिंग टू द नीड्स ऑफ द बॉडी. Now, the effect of drugs on the cardiac function. Sometimes we have to decrease the cardiac function to give rest to the heart, or to decrease the blood pressure, or to anesthetize a patient. And we see that the beta blockers, the calcium channel blockers, antiarrhythmic drugs, alcohol, and general anesthesia decrease the cardiac function. When we have to increase the cardiac function of a failing heart, or sometimes you give digitalis or you give calcium ions or you give drugs that mimic the action of sympathetic nerves or caffeine and theophylline, and in this manner you increase the cardiac function. What is the effect of physical training? The physical training increases the size of the heart by increasing the number of the actin and myosin filaments in the heart. It also decreases the baseline heart rate. So if a normal person has a baseline heart rate of 70 beats per minute at the normal vagal tone and normal sympathetic tone, an athlete will be having a baseline heart rate of 50 per minute at the normal vagus activity and normal sympathetic activity. And now comes your question, that what is the effect of increase in the heart rate on the cardiac cycle? So we shall be talking about this in terms of each and every part of the cardiac cycle. You see, Number one, you should see this diagram. If the end diastolic volume is 135 milliliter and end systolic volume is 65 milliliter, ये तो आपके पास हार्ट में पहले से मौजूद था. जो वीनस रिटर्न आ रहा है, अगर आपका नॉर्मल डायस्टोलिक टाइम है तो ये वीनस रिटर्न रैपिड फिल करने के बाद स्टेसिस में आ जाता है फॉर सम टाइम, एंड आफ्टर दैट इज द एट्रियल सिस्टली, and then you eject it during the systole 70 milliliter, and you reach the end systolic volume, which does not leave the heart at any time during a normal cardiac cycle. Okay, now you increase the heart rate. First of all, the diastolic time decreases. What happens? The same 70 milliliter, it comes to a halt here, and this area where there was stasis and no more blood was coming to the ventricles, this area, this time is shortened because of a decreased diastolic time, and the atrial systole comes here, and this causes filling of the heart properly by atrial contraction, and then you get the stroke volume here. So in the complete cardiac cycle, from isovolumetric relaxation time to isovolumetric contraction time to isovolumetric relaxation time again. This is isovolumetric relaxation. This is rapid filling. There is no reduced filling in increased heart rate. This is systole, and after the systole there is isovolumetric relaxation here again, and you see that the heart has completed its stroke volume without any deficit of venous return in a shorter time. After understanding this, now let's go here. Heart rate, if it is 75 beats per minute, what happens? Each cardiac cycle is of a duration of 0.8, and the duration of the systole here is 0.27. Duration of the action potential is 0.25. Duration of the absolute refractory period is 0.20. Duration of relative refractory period is 0.05, and duration of the diastole is 0.53. अगर आप 27 को 2 से मल्टीप्लाई करें तो ये बनता है 0.54. तो आप कह सकते हैं कि एक कार्डियक साइकिल में 1 टाइम सिस्टली है तो 2 टाइम्स डायस्टली है. एक कार्डियक साइकिल के आप 3 हिस्से करें तो उसमें से एक हिस्सा सिस्टली का है और 2 हिस्से डायस्टली के हैं. Now you see here, when you increase the heart rate the by 200 per minute, ये आप 75 plus 75 150 plus 75 215 है. So इसका मतलब है कि आपने 3 times नॉर्मल से अभी कम ही रखा हुआ है 200 पर. मैं कहूँगी कि 180 पर मिनट तक हेल्दी रहता है. 200 पर मिनट पर मसले शुरू हो सकते हैं. स्टिल इफ यू इंक्रीज द हार्ट रेट टू 200 times per minute, duration of each cardiac cycle is reduced to 0.30 seconds, and in 0.30 seconds there is 0.16 the duration of systole and 0.14 the duration of diastole. यानी कि यहाँ पर सिस्टली छोटी थी और डायस्टली जो है वो लंबी थी, 2 गुना लंबी थी. 0.27 और 0.54 में 2 टाइम्स का फर्क है. यहाँ पर सिस्टली बहुत छोटी नहीं हुई, 0.27 की बजाय 0.16 हो गई है, जो कि तकरीबन आधा टाइम है. फुल कार्डियक साइकिल के टाइम का आधा टाइम जो है वो 0.16 सेकेंड है, और ये ड्यूरेशन ऑफ सिस्टली है, और आधे से भी कम टाइम जो है वो ड्यूरेशन ऑफ डायस्टली है. तो आप इस हार्ट रेट के साथ जो कि 200 पर मिनट है, ड्यूरेशन ऑफ सिस्टली को कम करके 0.16 सेकेंड करेंगे तो होगा क्या, रैपिड इजेक्शन फेज में ही सारा ब्लड निकल जाएगा, और जो लेट इजेक्शन फेज में स्लोली ब्लड आउट जा रहा था वो भी रैपिड इजेक्शन में फोर्सफुल कॉन्ट्रैक्शन से निकल जाएगा. जबकि अगर आप ड्यूरेशन ऑफ डायस्टली को देखेंगे तो बहुत ज़्यादा हार्ट रेट बढ़ाने पर ड्यूरेशन ऑफ डायस्टली 0.14 सेकेंड्स तक कम हो जाएगी. Guide is provided to you for a rapid revision. Factors regulating stroke volume are quite a few of them are same: intrinsic property, nervous stimulation, humeral factors, temperature. Only after load is the factor in case of stroke volume, and reflexes are the factor in case of heart rate. And because after load is here in the stroke volume, and you see that the in the case of the heart rate and in case of the stroke volume, and diastolic volume is an important factor, the intrinsic property. So something about the end diastolic volume, it depends upon the ventricular distensibility, the duration of the diastole, the atrial contraction, and the venous return. This is to be remembered. When you are doing stroke volume, you have to remember it like this. When you are doing heart rate, you have to remember it like this, and then add this end diastolic volume. This is a portion in your book that you people confuse with the volume changes in the ventricles, and during a cardiac cycle. Most of you people, I don't know in which guidebook is this diagram made, but most of quite a number of students make this diagram and say that this is the diagram of the volume changes in the ventricle. No, the diagram of the volume changes is not this one. It has been discussed previously. Now, this diagram is given in your book to tell about the amount of energy converted to work by heart. So when the amount of energy converted to work by heart is calculated, the name given to it is cardiac work output. The name given to this cardiac work output, you know that the stroke work output is F into D, force into distance is equal to work. Force is the pressure change, एंड वर्क डन इज द वॉल्यूम चेंज. ठीक है, तो आपके यहाँ पर लेफ्ट वेंट्रिकुलर प्रेशर है, इंट्रावेंट्रिकुलर प्रेशर, और यहाँ पर आपके पास लेफ्ट वेंट्रिकुलर वॉल्यूम है. इन दोनों के अगेंस्ट जब आप डायग्राम ड्रॉ करते हैं, तो वो डायग्राम में जो एरिया अंडर इन बिटवीन दीज फोर लाइंस आता है, उसको हम कहते हैं वर्क आउटपुट. और ये एरिया वर्क आउटपुट जो है, ये आपका अमाउंट ऑफ एनर्जी कन्वर्टेड टू वर्क इन ईच हार्ट बीट है. जब आप स्ट्रोक वर्क आउटपुट की बात करते हैं, तो दिस इज द अमाउंट ऑफ एनर्जी कन्वर्टेड टू वर्क इन ईच हार्ट बीट. और जब आप मिनट वर्क आउटपुट की बात करते हैं, तो वर्क आउटपुट ऑफ द हार्ट इज द एनर्जी यूज्ड टू मूव द ब्लड फ्रॉम लो प्रेशर वेन्स टू हाई प्रेशर आर्टरीज per minute. So you can say that stroke work output is the work output of the heart, energy used to move the blood from low pressure veins to high pressure arteries per beat, and the minute work output is per minute. So you see, this is your starting point. Here you have got and systolic volume. At this time the pressure is almost near to zero. 5 कह सकते हैं आप, 3 to 5 millimeter of mercury pressure है यहाँ पर. At this point and systolic volume is there, and during the diastole you fill the ventricle with blood, and at 110 milliliter of the blood in the ventricle, atrial systole starts and pushes further blood into it to make it 125 or so. यहाँ पर ये 125 हो गया है. ये गाइटन की डायग्राम है, so it is going to give you 125 milliliters at the end of the diastole. Here the end diastolic volume is present. The pressure is now a little above the previous one, that was 3, now it is 5. Now isovolumetric contraction brings this pressure to 80 millimeter of mercury, that opens the aortic valve and the blood volume is ejected out of the heart. तो आपकी डायग्राम जो है वो अब वापस पीछे की तरफ जा रही है, क्योंकि वेंट्रिकल के अंदर ब्लड वॉल्यूम कम हो रहा है. So that with the ventricular pressure going on to 120 millimeter of mercury or 118 115 millimeter of mercury, finally the blood is ejected out of the ventricle. The aortic valve closes at about 100 millimeter of mercury. Isovolumetric contraction starts and the pressure steeply comes down to 3 millimeter of mercury at the end of the isovolumetric relaxation. This is The area in between these four lines, this is actually the force into distance. Force is pressure. This is the distance. The pressure gained during the contraction is responsible for a change in volume. When you increase the pressure, the change in volume is a decrease in the volume. When you decrease the pressure, the change in volume is an increase in the volume. This is not important for you for exam purposes. You only need to read that stroke work output is F into D, force into distance, force is pressure, distance is volume, and minute work output is output of the heart is the energy to move the blood from low pressure veins to high pressure arteries in 1 minute. Left ventricular work output is more than the right ventricular work output by 6 times. आपको याद है कि 6 times thicker है walls of the right ventricle than the walls of the 6 times thicker है walls of the left ventricle than the walls of the right ventricle. So this page is not important for you, but as you mix it with the page of volume changes in the ventricle during cardiac cycle, so आपको ये अलग से बताना. In this slide, what is very important is the definition of preload and the definition of afterload. Definition of preload is end diastolic pressure at the end of phase 1. This is phase 1 and the atrial systole increases the pressure to about 5 mm of mercury in the ventricle at the end of the diastole, and this is called preload. Afterload is the pressure in the aorta in phase 3. This is phase 3, and at the end of the phase 3, pressure in the aorta during the phase 3, pressure in the aorta reaches almost 120 mm of mercury, and that is the afterload. So what do we see? If there is aortic stenosis, you will have to increase the pressure to eject blood from this narrow orifice, and this will cause increase in the workload of the heart. If there is hypertension, the afterload pressure in the aorta is more, and you have to increase the force of contraction of the ventricle to pump blood into the aorta. So preload is the end diastolic pressure and afterload is the pressure in aorta in phase 3. Yes, this slide is important for you because it is telling you how do we get the energy for cardiac contraction. Fatty acid metabolism gives you 70 to 90% of the energy, and lactate and glucose metabolism gives you 10 to 30% of the energy. Apart from this area is not important. This is for postgraduate discussion, and only you have to see that during hypertension the oxygen demand increases, oxygen demand of the heart increases, and you need to spend more energy to push blood into the aorta during hypertension. During left ventricular failure, when the left ventricular muscle is not working properly and the diameter of the ventricle is increased, more muscle is present but it is weak, it is asking for more oxygen, and increased oxygen demand you can see occurs in left ventricular failure and in hypertension. That is all about it, not important for you. Now, if the work output produced is more and less heat is consumed for this work output, you are having an efficient heart. In case of heart muscle, it is different from the skeletal muscle. A lot of heat is produced, but most of it is wasted and work output is less. So 20 to 25% of this heat that has been produced gives you work of the heart, and the rest is wasted. In heart failure, this efficiency of cardiac contraction decreases by 5 to 10%. So heart failure में आप जो एनर्जी जो वर्क प्रोड्यूस करेंगे, जो हीट प्रोड्यूस करेंगे, उसमें से सिर्फ 15 से 20% आपकी वर्क आउटपुट देगी.